So Dr. Karanofsky, thank you so much for joining us. Thank you for talking to us here at Hope and Cope. And I'll let you take it away and introduce yourself. We can't hear you.
Hello, is that better?
Much better, perfect.
The joys of Zoom lectures.
Yes, exactly.
So thank you very much for inviting me and having me here. This is my second time giving a lecture for Hope and Cope. I guess a little bit just about me before we get started. I am a general dentist. I work at the Jewish General Hospital in the dental department. And I've pretty much spent my entire career working in the hospital so far. So this is just, I guess, a little tidbit on cancer care and oral health. I have already gotten a few pre-submitted questions, but I promise you that if you have any questions, feel free to send them on in the chat, and there will be time at the end if you want to ask me questions, you name it. That's not a problem. So just a few little reminders, I guess. I'm more than happy to translate anything into French. Si vous avez besoin d'une traduction, aucun problème. So just, again, if you need a translation at any point, just let me know. But obviously I'm a little bit more comfortable in English, so I did make this lecture in English. Question period, as I said, at the end, and there is a slide with a few sites that have some really good resources for patients with cancer relating to oral health. I guess we'll get right to it. So a little outline here about what we're going to be talking about a bit tonight. So we'll talk a little bit about general oral health and how that might relate to cancer treatments with regards to medications or radiation, a little bit about the immune system and the effects that cancer treatments might have on that. Dry mouth is a very broad topic. A lot of medications, a lot of cancer medications or non-cancer medications can have a side effect of having dry mouth. So that is definitely something that affects the oral cavity and oral health. And at every point in the equation, communication is key. So as I said before, I do work in a hospital. I do speak with oncologists and physicians on a regular basis. And it's really important that everyone's on the same page so that you as the patient are much more aware of what's going on and much better able to take care of any issues or prevent any issues from arising. So a little bit about general oral health, and this pretty much applies to anyone and everyone. Gums are a very important part of the mouth. You want to make sure that they're healthy. There's no sores, there's no swelling, no inflammation. Teeth, we talk about caries being, a cavity or the tooth starts to wear away because bacteria are eating away at the teeth. With dentures, if you have dentures that replace missing teeth, you want them to be well-fitting, that are not going to irritate the gums, to be functional, obviously, and obviously clean. That applies to everything. And pretty much anyone and everyone should have regular visits with a dentist. So I really tell all of my patients that at the bare minimum, you should be seeing a dentist at least once a year. And so I think that applies to everyone. Now, some patients do require more visits than once a year, but I think that as a general rule, everyone should be seen at least once a year by a dentist. So here's where we're going to get into a little bit about the different treatments that cancer patients might undergo, whether it be chemotherapy, that obviously can or cannot in some scenarios affect the immune system. And again, the secondary effect being dry mouth. Some patients will get radiotherapy. At the hospital where I work, for instance, at the Jewish, any patient that is going to be undergoing head and neck radiation is sent for a consult to the dental department, whether it be me or one of my colleagues that will assess these patients. But it is something that we will want to assess prior to radiation therapy starting. And the other side effect that happens from radiation therapy to the head and neck area is, depending on the dose that is received to certain areas of the jaw, there is potential for reduced healing in those areas. So when I get these consults, oftentimes the radiation oncologist is going to send me a document that shows the area of the mouth or the teeth that are going to be most affected by the radiation. And those areas are really, really important to stress that they're in good shape prior to radiation, because there is that reduced potential for healing after that radiation occurs. So that's something that we really, really stress, and that's one of the reasons why we get those consults pretty much 100% of the time before patients start radiation therapy. All right, so I'll get to the questions regarding this at the end, I guess, because I'll just continue with my slides here. All right. So there are some cancer therapies that will decrease the function of the immune system. Okay, and when that happens, there are a few potential effects in the mouth. So oftentimes, as you'll see if you go to some of the resource links that I provide later on, they talk a lot about mouth sores, and it's a pretty broad concept, but basically, you know, we use our mouths for a lot of things with regards to eating, and you know, the soft tissue can, you know, take a lot of forces, and if your immune system isn't ready to sort of help that out, there you have a much more higher vulnerability for developing mouth sores. And so chemo can affect that for sure. Certain types of chemo can also, you know, cause you to have issues with inactive infections. So sometimes you have patients who, you know, have just latent inactive infections that are visible on X-ray that, you know, at this point in time, they're stable and balanced. However, if, you know, you have something that's going to affect that balance of the immune system, for instance, with chemo, those inactive infections can therefore sometimes be reactivated and cause some major issues. So, you know, I said it before with regards to patients being seen at least once a year to you know, for their general checkups. This is something that we're going to look at for anyone and everyone, but for patients who may be starting chemo in the near future, this is definitely something that you want to have checked before and treated, because if your immune system has been decreased and all of a sudden you have an infection, it's something that may reactivate and cause major issues. And so, you know, oftentimes when I bring this concept up, I have, you know, patients ask me, you know, whether or not every person who's going to start chemo should really be seen right before they start their chemo. And, you know, in an ideal world, the answer is yes, but sometimes delaying chemo is not a good thing either. So that's, again, bringing back the idea of communication. Dentist, oncologist, and patient should all be, you know, all together in terms of talking out these issues prior to making any, you know, rash decision, I guess. So, for instance, I've sometimes had the discussion with oncologists saying, you know, this tooth needs to come out prior to starting this chemotherapy. And the oncologist will say, really, you know, I really don't want to delay treatment by X number of weeks because we would need to wait for healing. What's the risk? And we'll have those discussions on an individual basis. So dry mouth, a lot of different things that can cause dry mouth. And, you know, saliva has a lot of functions. But one of the main things that saliva does is actually help reduce the risk for decay in teeth, as it'll flush any bacteria or food away. It can lubricate teeth. There's enzymes in teeth, in saliva, sorry. So when you have lowered salivary flow, which is a very common side effect to a lot of medications, let alone radiation especially, salivary glands don't like radiation. So any radiation to this area of the head and neck is very likely to cause some form of lowered salivary flow. Usually, however, in radiation, it's a temporary thing that will only last for a few months. But as I said, you know, with less saliva in the mouth or different quality of saliva in the mouth, you definitely have an increased risk of developing cavities and caries, let alone discomfort and obviously the potential for mouth sores as well. So dry mouth is one of those things that we really need to pay attention to and control. So what can you do? So with regards to mouth sores, you know, there are, you know, things that you can do to prevent, and there are things that you can do to try and treat. And so I would definitely recommend that if you're prone to getting mouth sores, avoid any irritants that might cause you to have more mouth sores, such as hot and spicy foods. Okay, these foods are much more likely to cause these mouth sores to develop. alcohol and smoking, that goes without saying with regards to your overall health, but for sure with these, that's very likely to be an irritant. If you have dentures, whether they be partial dentures or full dentures, complete dentures, if they are loose and irritating your gums, you're definitely more prone to getting these sores. So that's something to look at for sure, whether a denture needs to be remade or adjusted. That's to be discussed with your dentist or denturologist. Typically a denture, a decent denture on average should last a good 8 or so years. And so if it's time to redo a denture, well, that might be your case. Salt water is one of the simplest things you can do to, clean the soft tissues in your mouth. I recommend saltwater rinses on a regular basis for any number of patients, but anytime there's something, irritating the soft tissue in the mouth, salt water, whether you use baking soda or not, can be really, really helpful. Oragel and other, products that are out there can help with the pain and relieve the soreness from these sores. Just as a side note, I am not paid by any company to recommend any product. There's no, issue there with regards to those companies. So Oragel doesn't pay me to put this in my slides. All right. Dry mouth. So this, not let alone comfort, but for the help of keeping your mouth and teeth healthy, combating dry mouth is something that is somewhat important here. So there are many ways and there are many different products. These are just a few of the ones that I've noticed that patients really, really like. So here we have, any, sugar-free chewing gum with xylitol. You'll see the word xylitol on a few of these products. It's a sugar substitute that really promotes good oral bacteria and good oral health. So you'll see this a lot, but chewing gum can definitely stimulate salivary flow. Biotene is one of those wonderful companies that has a whole slew of products that can help with dry mouth as well. Here you have Prevident 5000, which is a high fluoride content toothpaste, which will help protect the teeth, but this is also a dry mouth formulation. These are xylem melts, okay, and I often will give these as a recommendation to patients who have undergone or will be undergoing radiotherapy to the head and neck. What these are, they're these tiny little, they look like little mints basically, and you basically put them in your mouth and they stick to your gums, and very, very slowly over the span of an hour or two, they will melt and basically sort of simulate as though you are salivating naturally. And so I have patients who love these and really, really find that this helps for dry mouth. But oftentimes when I'm talking to patients who recently have a diagnosis with cancer with regards to their oral health, I'll really just recommend that they carry a bottle of water with them regularly, and just regularly taking sips throughout the day can be very, very, very helpful with regards to prevention of dental issues. So these are a few little things on how to fight dry mouth. I mentioned fluoride before, but I guess I'll just touch upon it a bit more here. Fluoride helps remineralize teeth and create strong teeth. And there are many different ways to deliver fluoride to the teeth. The obvious and most common one being toothpaste. And this goes for anyone and everyone. You should be using a toothpaste that has fluoride in it. It's been shown for decades how the benefits of fluoride with regards to teeth. But while, undergoing a period of dry mouth where you're at risk of, having teeth demineralize and create decay, fluoride toothpaste, might not be enough, and it might be some time to add other ways of delivering fluoride to teeth. These are two different variations of mouth rinses that have a fluoride content as well that can help deliver more fluoride while that balance is shifted. And fluoride gel on these trays, I make these for all of my head and neck radiation cancer patients. And essentially it's just something that I recommend these patients to wear for a good 5 minutes a night, again, just to deliver a higher concentration of fluoride to help protect their teeth during that vulnerable period. So as I said before, I stress communication. It's very important. And it's goes without saying that everyone should be discussing these things with everyone so that everyone knows what's going on. And so I said I'd mention a few resources here. And so you can go to these sites by all means. You'll have a copy, I guess, of these. I'll make sure that Carly has a copy of these resources here. But there's a lot of overlap between them, but they go through a lot of these concepts as well in much more detail than I just did, I guess. But the general concept is basically what I've mentioned already. And so this is my pandemic puppy. And I guess at this point, I'll go on to the questions. I know it's a bit short of a lecture, but I figured that the questions would probably spark more discussion than anything. So is it all right, Carly, if I go to the questions at this point?
Yeah, why don't we start with the ones that were submitted in advance, and then there were a few in the chat, and then after that, I would encourage anyone who would like to unmute themselves and ask out loud. So after all the questions have been read out, we can go on to people who want to unmute.
Perfect. So I think this question was asked in the chat also, because they look somewhat similar, but might cover two questions at the same time. So the first question I had submitted, I think I sort of answered it within the slides here, but the question was, how do I care for my teeth after chemo and radiation treatments? Maybe just a quick little point on that. As I said before, anyone and everyone should be seen by a dentist regularly, whether that be once or more a year. And your dentist should be versed in the fact that you've had some form of chemo or radiation treatment, and that should be discussed when you go over the medical history with your dentists. So that's something that would be important to discuss. The next question I have here is, I have major dental challenges and work ahead on my teeth due to cancer treatments, scans, radiation, etc. No dental work done from 2013 to 2018. I have no dental insurance. So if I get 3 root canals, do I have to get crowns? If I don't get crowns because they are expensive, what is the risk to my teeth considering the cancer treatments I've had? If I do get crowns, how long will they last? And then the next follow-up question is, should I get dentures, and what are the negatives of getting dentures? So there's a whole lot in there, but I'll try and touch upon those points, and if I fail to answer something, please let me know. So the first thing here is, if you get root canals, do you have to get crowns? So a root canal is needed when the nerve of a tooth is dying or dead, and that can lead to an infection. And so it's something that you would consider as a way to save the tooth. Okay, so ultimately, if the nerve of a tooth is dead, your options are to do a root canal or to extract the tooth. In broad terms. Okay, so if a tooth is completely destroyed and can't be rebuilt, then unfortunately the only option is to take out that tooth. So that's ultimately what a root canal is. Now, root canal is typically needed when a large portion of the tooth is eaten away by decay. So typically in those scenarios, the teeth have been severely compromised and are quite weak. And so that is typically why a crown is something that we would recommend after a root canal is done. Now, is it 100% obligatory to get a crown after a root canal? Definitely not. However, there are many cases where I would say it doesn't necessarily make sense to do a root canal if you're not going to do the crown afterwards, because you are at a big risk of fracturing the tooth and therefore losing it. And so, are there root canals done without crowns? 100%. I would advise you to save teeth when you can. I understand the cost for teeth for dental care is very expensive. And so with regards to cancer treatments, that's not necessarily something that would play into crowns or not. However, if you do get crowns, how long will they last? I've had patients ask me this question, whether they have cancer or not. And my answer typically is, if my crown that I make you doesn't last a good 10 years, I personally would be upset. Like it would bother me. Now, does it happen? I've been in practice for 8 years, and the one time I've only had one crown fail on me so far. And the one time it happened, I was very, very upset, to the point that the patient called the next day and checked on me to make sure that I wasn't too upset. So I would expect the crown that I make to last a good 10 years. If it doesn't, I'm going to be upset. But the average should be somewhere around 10 years for a crown. Should I get dentures, and what are the negatives of getting dentures? So dentures are a great way to replace many teeth in a simple way. There are many different types of dentures. There are many different types of complete dentures. There are many different types of partial dentures. Partial dentures being dentures that only replace, a few teeth, if you're only missing a few teeth in one arch. The negatives, I guess, of dentures are that, it's not the same as having something fixed in your mouth. So, natural teeth, they don't typically, you're not able to remove them from your mouth. A denture is removable by nature. And so having something that is removable, it's not necessarily as stable, and function-wise, it's not necessarily the same. Now, if you've never worn dentures before, don't expect to get a denture day one and be used to it. It takes time to get used to it. You have to, sort of how to relearn how to ride a bike or chew your food and speak. And so there's a lot of learning associated with getting a denture for the first time. Now, having said that, if you have a lot of missing teeth, it's a simple way of replacing those teeth. So, dentures are great when they're needed. It's never necessarily the first, the ideal option. Dental implants have come a long way to replace missing teeth. But having said that, obviously implants are quite expensive. I hope that answers that question. And then I had another question submitted here. I have taken these medications for my ovarian cancer. I had some dental pain during treatment, but no more. My worry is, how does it impact my teeth in the long run? So I hope I answer your question here with regards to it impacting your teeth being your cancer treatments. Typically when I have patients who come to see me and they tell me that I had a problem and it went away, usually, and again, I'm saying this very vaguely, but the usual response that I will give is, if it's something that went away and I can find no signs of it, I can't reproduce your symptoms. A patient comes to see me and they say, oh, this tooth hurt and then it went away. And then I will see the patient for a consultation and an exam and, take x-rays and do tests on basically all the teeth in the area. If I cannot replicate the symptoms that you had, pain to biting, well, if I can't actually test a way and find a way that your tooth is hurting, chances are I'm going to tell you to wait and see. And usually it's something that will resolve on its own and won't come back. If it's something that is, super severe and, this happened in the past, typically there's going to be some form of sign when you go see the dentist. So it'll be very evident to the dentist at the time that you see them. So I've had patients who tell me, they saw a dentist a year ago and they told them that a tooth was problematic. Well, if they haven't seen a dentist in a year and there's nothing that's obvious, clearly whatever was, an issue back then was something very transient and not a long-term issue. So I hope that answers your question, and correct me if I didn't. So I guess I'll go to the chat here and try and answer the questions here. So I wonder if the bone of the tooth broken, what should I do? I'm not sure I understand that question. I wonder if the bone of the tooth broken, what should I do? I would need some clarification on that question there. I had a root canal last July, no crown. I recently ate a lot of hard peanuts and now feeling pain. So I sort of touched upon this earlier with regards to root canals without a crown. You know, the most common effect that we see on teeth that have had root canals without crowns, and sometimes even with crowns, to be honest, is that so much of the tooth is no longer natural tooth structure, and it's restorative material, and teeth become weak, and over time teeth can fracture. And so if you are experiencing pain, you should see a dentist for sure. But you know, in the back of my mind, especially with your telling me that you ate a lot of hard peanuts, that's a pretty telltale sign that there might be a fracture going on with this tooth and would need to be assessed. So the next question I have here, I need to have one more root canal done, just completed the first one, we'll need 2 crowns. I think this is probably the same question that I referred
Yeah,
to.
this was the first question, the first set of questions that you answered. Yeah.
Yeah, the question's answered.
Okay, perfect. Once chemotherapy treatment has ended, what is the long-term care for teeth and gums? So this, I would definitely go back to my comment about communication with the oncologist with regards to this. So I have multiple patients who have undergone chemotherapy and different types of chemotherapy. And essentially, I need to know from the oncologist what sort of effects this might have to the immune system, for instance, with regards to treatments that I might be proposing for patients' teeth. So, you know, say a person needs XYZ dental therapy, I need to know to make sure that their chemotherapy hasn't necessarily affected any of their immune system values long term. And potentially timing of treatment is important. So, you know, within that discussion, if a tooth needs to come out and, you know, I don't deem the risk of infection to be very high, sometimes the oncologist will tell me, you know, they have this bout of chemotherapy coming up, and then they're going to have a window where you might be best to do your treatment. And so that discussion really is on an individual basis. But if chemotherapy is finished and you know you're back to your regular immune system values, typically for me, I would put you probably in the same category as someone who's never had chemotherapy with regards to your dental care. I can't think of any scenario if your immune system is back up to normal, if a history of chemotherapy would affect anything that I would do. The only change that I might make is with regards to radiation therapy to the head and neck area. So I don't think chemotherapy would really affect anything my end, I don't think, as a dentist. Should I go see my regular dentist before the chemotherapy, or should I go see a dentist similar to you? That's a very good question. I would want to make sure that whoever you go see is comfortable treating patients who might be undergoing chemotherapy. I can tell you from past experience, there are many dentists, by far the majority, who would feel comfortable treating patients from, you know, different medical backgrounds. And having said that, I know that there are dentists who don't feel comfortable treating certain medical backgrounds. So as long as your dentist is comfortable, I have no issue with you seeing any dentist, or, you know, especially if you've been followed with that dentist for X number of years. That's something that is very important, you know, that can't really be replaced necessarily. If a dentist is very familiar with your own oral health and your own dental situation, that's something that has value with regards to that consultation as well. But if you can see a dentist before chemotherapy, I fully recommend that. I had implants done 3 years ago. Will the chemo affect it? If they're in good health and there's no issues with those implants, there's no reason why having chemo would affect that. As well, you know, I'll take that a step further with regards to radiation. If you are getting radiation and your implants are in good health, there should be no effect to that. Now, having said that, I want to stress the point that patients should be seen regularly by a dentist at least once a year. Okay. What can I do if chemo loses my taste? I'm assuming you meant the taste buds there. What are the important features that should be in toothpaste? Okay, so with regards to taste, there are a lot of things that can affect taste. With regards to chemo, that's very likely a medication-specific question that the oncologist might be better at answering. Now, having said that, I can't remember ever seeing a patient or hearing of a patient who lost taste permanently. So there are definitely treatments that might affect taste on a short-term basis, but long-term, I cannot think of a time where I've heard of something it being long-term, having long-term effects. So if that is the case, I would definitely speak to the oncologist and try and find what that issue is. But temporarily, sure, there are even mouthwashes that can cause some temporary taste loss as well. The important features that should be in toothpaste or mouthwash. So from an objective point of view, toothpaste should definitely have fluoride. Okay, that is, simply put, if there's no fluoride in your toothpaste, find a different toothpaste. There are some toothpastes that have, I don't even remember what they're called, but there's those little beads in some toothpaste that are used to sort of be as a friction agent to try and clean teeth more. I have had patients, whether they have cancer or not, tell me that it really, really irritates their gums. If that's the case for you, find a different toothpaste. Any of the major companies will have multiple formulations of their toothpaste. Toothpaste is one of those things that, if it has fluoride in it, I'm happy you're using it. The only time that I really recommend different kinds of toothpastes are if patients are at high risk of demineralization, in which case the Prevident 5000 from Colgate is a wonderful, wonderful toothpaste. It has a much higher concentration of fluoride, and I will recommend this in certain scenarios. And the other scenario that I recommend different types of toothpaste is if you have sensitivity. So if you drink a cold glass of water and you feel it really strongly in your teeth, that's typically a sign that you have some form of hypersensitivity of your teeth. And sensitive formula toothpaste can definitely help. Whether it be any of those companies, they all sell a formulation of sensitive formula toothpaste. So stick with that. With regards to mouthwash, I can tell you from a personal point of view, I personally like the Listerine alcohol-free. It's what I use every night. I don't personally like the alcohol content mouthwashes. They can have an effect of irritating issues as well because of that alcohol content. So if you want to steer clear from the alcohol content ones, you should. With regards to mouthwash, I mentioned it earlier, salt water is, a simple replacement for mouthwash that you can do as many times a day as you'd like, pretty much, provided you're not swallowing all that salt. And that can definitely be a help. Earlier in the slides, I mentioned a fluoride-based mouthwash as well. Again, if you are at risk of having demineralization, then that's something that I would recommend you start using, is a fluoride mouthwash as well. So next question, I am due for 2 implants and wonder if it would be best to wait until chemo is complete before having them done. So again, I'm going to stress communication in this note. It really depends on what type of chemo you're getting and if it's going to affect your immune system. So, sorry, there's my dog. Ollie, hey. So with regards to that, if your chemo will be affecting the way that your immune system reacts, then yes, I would definitely delay having the implants done. Just to clarify, I'm assuming this is the implant surgery where the implant is actually placed into bone. That is the part that I would delay. If it's really just for the crown, so what I mean by that is you're just taking an impression on already placed and healed implants, I really wouldn't worry too much about that with regards to chemo. But again, these are all elective therapies. And so if you feel more comfortable delaying them, I don't see a reason why not to delay them. So I wouldn't push any patient to undergo these treatments. Again, provided I've already spoken to the oncologist and cleared that it is okay to go ahead with these surgeries. I would like to know if the tooth is broken, what should I do? Okay, so with regard to that, so it depends. If your tooth is fractured in a catastrophic way, meaning, you know, there's a fracture line that goes down the whole tooth and it's in two pieces and floating, unfortunately, the only thing that you could do at that point is take it out. If the tooth fractures in a way that, you know, we can still build it back up, then you know what, then you can potentially save that tooth. Having said that, the majority of times that teeth have had large fillings with root canals, with, you know, a history of eating hard foods, it typically is pointing to the case where the tooth is fractured in a way that can't be saved. You know, the only way I can, the only way you'll get a definitive answer is by actually seeing a dentist, I guess. But if the tooth is fractured catastrophically, unfortunately, you're looking at losing that tooth. How about kids' toothpaste? Any brand? Is the fluoride in kids' toothpaste enough for adult? Is that okay to use it during chemotherapy because of the flavors okay during my metal taste? Okay, so these are a few questions in there. So with regards to kids' toothpaste, you need to be aware of the fluoride content in that. So there are actually kids' toothpastes that have 0 fluoride in them, and there is a valid reason for that. With children, so just as a side note, I guess, if you have children who are starting to brush their teeth, I guess is a time to mention this point. With regards to kids brushing teeth, the youngest children obviously are not necessarily going to spit out that toothpaste, and they're going to swallow a lot of it. And so with kids who are going to swallow toothpaste, you don't want them to ingest too much fluoride because that can have, you know, effects of staining teeth. And so if your kids are old enough to spit out their toothpaste and they're reliably doing that, then yes, you can switch to a kid's toothpaste. You can use a kid's toothpaste with fluoride as they start to learn to spit out that toothpaste and they're not ingesting too much. If you find the flavor is okay during the taste that when you have a metal taste in your mouth, I don't want to say anything too broad that would apply to too many people here. Because I like to treat every patient as though they're different, because they are. And, you know, patients who have a high risk of having issues are patients that I'm going to push to use different things than if a patient has low risk of having dental issues. So I guess as a tangent to that, if I have a patient who I know isn't going to be undergoing radiation therapy, and they go to their dentist twice a year, they have spotless teeth, they have no dental caries, they have healthy gums, healthy teeth, you know, I'm going to basically discuss with them all the ways to help prevent problems, but I'm also going to tell them that their risk is very low. Now, having said that, if, you know, you take the opposite side of that coin, you have a patient who really doesn't take care of their teeth and they're going to be undergoing, you know, some form of radiation therapy, we really need to try and throw everything at that to really, you know, reduce their risk of having issues because of their cancer treatments. So to answer your question, I guess, is if you're at low risk of having dental issues and, you know, you take good care of your teeth and your teeth are not, you know, at all at risk because you do those things, switching to a kid's toothpaste, provided there's a little bit of fluoride in it and you prefer it because of the metal taste, if you are a low risk patient, I would say by all means go for it because you're at low risk. You know, I hope that answers your question. Oh, thank you for the comments. I appreciate that. You can buy Prevident on Amazon for $12, which is a good. Oh yeah, it is. Prevident is a rather expensive toothpaste compared to others. But if it's something that, you know, a dentist recommends you use, great way to, I guess, save money on Amazon. But yes, it is much more expensive than your average toothpaste. And with regards to Prevident, I guess I should add another note. Because of that price, sometimes what I'll recommend patients do is they use their regular toothpaste in the morning, and they'll use Prevident in the evening at night before going to bed. And it's just a way to sort of save a little bit because it is rather expensive with regards to toothpaste. So I think I've reached the end of the questions on the chat. If anyone has any other comments or questions, I'm more than happy to take them.
This is a time when anyone who wants to unmute their microphone and ask out loud, you're more than welcome to do that. So we'll wait for a couple more minutes because I don't see any more questions coming in the chat. I got a thank you here. I see someone unmuting. Nikki, did you want to ask a question?
No, not.
Okay, no
I
problem.
was just unmuting in case.
Okay, no problem. I think that may be it for this evening. Oh, I see. Dahlia, did you want to ask something?
Yes,
Go ahead.
I made a root canal and I went to the dentist to make a crown. Instead of crown, the dentist put filling. And after years, I have a crack.
Mm-hmm.
Do you think because she didn't put to me the crown, because of that, I have the crack?
So it's a question that I've been asked before as well. You know, if I would have put a crown, would it have prevented this? The truth is, no one can actually tell you yes or no to that question. What crowns do is they reduce your risk of fracturing teeth. Now, does it prevent 100% of cracks? There's no way that that's true. However, based on, you know, the best possible scenario, a crown is the way to reduce the risk of a crack, but it's not going to prevent 100% of cracks. There are teeth that have crowns that crack as well. So I don't know if that answers your question per se, but there are teeth with crowns that cracks. There are teeth without crowns that don't crack. It's just that given a certain situation, if you have a lot of tooth structure missing, a crown is the best way to reduce the risk of fracturing a tooth, but it doesn't reduce it to zero, unfortunately.
Thank you.
No problem. So I see there's another question in the chat, so I guess I'll go to that. Is it good to use professional care toothbrush? I'm assuming you mean by that that's a brand of electric toothbrush, correct?
Yes.
Okay. I just wanted to confirm because I'll be honest, I don't know all of the toothbrushes out there. So again, I'm going to go back to my comment earlier about individualizing care. If I have a patient who comes to see me and they have spotless teeth, I'll be very honest with you, I don't really care what kind of toothbrush they use because clearly whatever they're doing works. However, if I see a patient who really has a lot of plaque and, you know, I go over what their regular routine is and they don't use an electric toothbrush, it could be something that I would add into the equation of things that I would like to try to improve their oral hygiene. Now, having said that, is it better to use an electric toothbrush versus a manual toothbrush? You can get the exact same result with a manual toothbrush that you can with an electric toothbrush. The only time that I really would say that an electric toothbrush is quote unquote necessary is with limited mobility. So if patients don't necessarily have the dexterity to actually brush their teeth with their hands, in those scenarios, electric toothbrushes really can help a lot in improving patients' oral hygiene. So does everyone need an electric toothbrush? No, I've had one in the past, but currently I'd much rather brush my own teeth with a manual toothbrush because I get just as good as a result. So I hope that answers your question as well.
Thank you, doctor.
Doctor, I have another question. Rinse the mouth with salted water. If somebody wants to limit the amount of sodium, it will not hurt to use salted water?
I'm sorry. So the question was with regards to rinsing with salt water.
Yes.
If you're worried about ingesting too much salt, that was the question.
Yes.
So typically, when you're rinsing with the salt water, you shouldn't be swallowing it. You should be spitting it out. And so, I mean, by salt water, I guess I should have clarified. Typically, when I recommend saltwater rinses, about a cup of water, maybe a half a teaspoon of salt to rinse with that. And if you rinse with that and spit it out, you know, that's not necessarily going to cause too much of an issue with regards to ingesting too much salt. I don't think that would be a big intake of salt on your part. And if you were concerned with that, you could always just rinse with regular water right after. The salt to your gums would already have its effect. So I hope that
Thank
answers.
you.
No problem.
Hi, good evening, doctor. I do have a question regarding my general dentist, because I will start my chemotherapy very soon, and you just mentioned that majority of the dentists should be comfortable to treat. I mean, to treat people like me, right? Yeah. And then because actually I'm not so sure, and I need to check with him, and if, I mean, just in case, if he tells me he's not comfortable, should I make appointment with you, or so how can I find another dentist who's comfortable with this?
So I think I touched a bit upon this earlier, but I work in a hospital, so I see patients from all sorts of different medical backgrounds. So I mean, there's rarely a time that I don't think I will turn away a patient because of their medical background. But having said that, there are dentists who don't. So if you would like to come see me, you are more than welcome to. I have no issue with you making an appointment with me. That's not a problem. But many other hospitals as well have hospital dentists. Dentists who have gone through a hospital-based residency program as well would likely feel comfortable treating patients from different medical backgrounds. At the Jewish, we train six dental residents every year who have gone through dental school, and they get a lot more exposure to patients from different medical backgrounds, including cancer patients. I imagine that the majority of dentists will probably be comfortable, but if you're unsure, there are many who would feel comfortable. And again, if you want to come see me, I'm more than happy to see you, no problem.
Okay, thank you so much. Yeah, doctor, thank you.
So I have another question here. 1 cup water, salt. Okay, so sorry, I just want to answer the one question that's left in the chat here. 1 cup of water with about a half a teaspoon of salt, and or a half a teaspoon of baking soda too. I can't remember ever really stressing the baking soda. I mean, some patients love it. They find a recipe online and they go with it. I typically just say salt water because most people have tons of salt and it's relatively easy to get.
Doctor,
Yes.
I have another question.
No problem.
Taking calcium can strengthen the bone in the gums?
So calcium with regards to bones is more of a medical based question, because that's not something that as a dentist I would ever prescribe to patients. So I would rather leave that to the medical field, because it's not actually in the purview of a dentist to prescribe calcium. Now, with regards to teeth themselves, you know, your teeth develop when you're rather young. And so taking calcium supplements don't really have much of an effect on teeth at this point, once they're fully developed.
Thank you.
No problem.
I have a question.
Yeah.
Can you hear me?
Mm-hmm. Yes.
Okay. I finished a chemo treatment last August, but I'm still experiencing dry mouth. And I wanted to know, does this ever go away?
So dry mouth is one of those very uncomfortable things. You just saw me drink water because I don't like it either. So I you know, dry mouth is not fun. It's a tough question to specifically answer, so I'll try and cover a few points on it. There are many medications that cause dry mouth. So if you're on other medications at this point, if you look at the side effects of vast majority.
No, I'm sorry. No, doctor, I'm not on anything actually.
Okay. So forget that point. But moving on, sometimes with regards to dry mouth, I'll give you an example with patients that have received head and neck radiation. Oftentimes what I'll tell them is that with your treatments, you will likely experience some form of dry mouth. And usually the vast majority of patients, it will come back to some degree. Now, it doesn't necessarily happen right away. And you said in August, so we're looking at, a good number of months already. It depends on your chemotherapy drug that was given, or drugs, I guess. And it would be more a question that I would ask your oncologist as well. Because it's rare that, have you noticed any improvement whatsoever, or is it still the same level as it was from the get-go in terms of having really dry mouth?
It's funny because it fluctuates. Sometimes, some days, I don't have any dry mouth, and other days I do. So it fluctuates, and I did speak to them, and they're not able to help me out or give me an answer with that.
So there are patients who really just present to see dentists, and their only issue is that they have dry mouth. So it could be something else that might not be necessarily related to your chemotherapy. And it could just be that, there are conditions that do have just dry mouth as a constant symptom, sadly. And these patients really, unfortunately, have to, use a bunch of products on occasion to help control their dry mouth. So I don't know if it's necessarily, it's impossible, obviously, for me to say if it's 100% related to your chemotherapy or not. But the fact that it comes and goes leads me to think that it's probably not. Having said that, have you tried different, I would recommend you try different products when you do experience dry mouth, and see if that helps, and see over time if it slowly improves. It could also be diet related. So that's another thing. It's tough to give you.
How so with the diet?
Well, certain foods will cause you to have drier mouth. I'm sure you've, if you have a lot of salty foods,
Okay.
you know what I mean? Things like that, that might experience you to have dry mouth, but it's tough to give you a definitive answer. Sorry.
And I could come and see you, right?
You're welcome.
Yeah. Okay.
Yeah.
And you're at the Jewish, you said?
Yeah. The dental department at the Jewish Pavilion A.
Okay. Thank you.
No problem.
Doctor,
Yes.
this is Stan. I just wanted to comment about chemo. I had 5 months of chemo, and basically I lost all my hair on my arms, the top of my head, and my legs. Plus, I also got impacted in terms of I lost my sense of taste, and I lost my sense of smell. My sense of taste is back. My sense of smell is back. I now have hair on my arms and legs of a 10-year-old, and my hair is growing back on my head. So for those of you, don't worry about chemo. Things will come back. They come back slowly.
Thank you. Thank you very much for that comment.
Looks like it might be it.
Doctor,
Never mind.
Yes.
Go ahead.
I'd like to ask, what are the long-term effects of long-term chemo on the teeth and on the gums? Is there anything that's pretty common?
So it's going to be very specific to whatever type of chemo you're getting. There are some very targeted chemotherapy agents that really don't have any effect sometimes on teeth. And those are typically the ones that would be used long-term, but I guess it's very much medication specific. And with all the different chemotherapy agents that are being used and tried, and different trials of different medications, oftentimes, I would say 99% of the time, it really requires me to have a conversation with the oncologist to say, and discuss the potential effects of said drug on a patient's mouth. So I'll go back to my broad statement of, if it does affect your immune system, not only is it going to have effects on other systems, but for sure with regards to the mouth, if your immune system is functioning at a lower capacity, there are definitely risks to your teeth. But the risk is more if your immune system is lowered over a longer period of time. You definitely want to make sure that any issues that arise in the mouth are handled very early, because if you do develop some form of an infection because of an untreated problem in the mouth, if your immune system is lower, that obviously is going to be a much more elevated infection and problematic infection, I should say. So, you know, I stress that patients should be seen regularly, but for patients who have a decreased immune system, should be seen much more regularly. And if there is an issue that arises, needs to be dealt or managed early on. So I hope that answers your question.
Yes, it does. Thank you.
No problem.
Okay, ladies and gentlemen, I think I might have
Yeah.
to do it. I can take one more person. I see Lee Wang. I think I see that he's
Yeah.
interested. So go ahead.
Yeah.
I'm gonna have to
Yeah.
say goodnight, but go ahead.
Thank you so much. Yeah. Okay. So doctor just mentioned, yeah, if we have a lower immune system, we should go really see the dentist even more frequent, right? Yeah. Because right now I'm seeing the doctor, like the dentist, every 3 months. So my question now is, yeah, should I skip one visit during my chemo? Because my chemo will be like I think last about 6 months. So that means, yeah, I will have one regular appointment during my treatment. So should I skip it or should I still go?
I'm not sure I understand. You're currently going every 3 months, and your question
Yes.
is, should you skip it while you're undergoing your chemo treatment? Is that the? I just want to confirm that that's the question.
Yes, exactly.
Okay. So
yes, exactly.
Provided that there's no reason your oncologist would say don't go see the dentist. As a dentist, I have no reason why you shouldn't go see the dentist. Being seen during your chemotherapy is not a problem, because you know, if you're regularly being seen every 3 months, that's great. Because if that's what you need, it's good that you're going. But from a dental perspective, I see no reason why you would skip that appointment. Yeah, because if there is anything arising, better you should be. And if you've been put on a 3-month recall, meaning you're being asked to go back to the dentist every 3 months, you should continue that from a dental perspective. There's no reason not to. So
because the question, I asked that question because I know when you have the lower immune system, you have more chance to bleed, right? Yeah. So that's why I'm trying to see if I go to like the doctor, like to do the cleaning, like whatever, could that really cause some bleeding issue?
So this is a concept in dentistry that we talk about risk benefit. And so if, you know, there's a risk that, you know, you're going to develop periodontal issues, gum issues, from not having seen a dentist every 3 months, there's a risk to that as well. And so we sort of have to evaluate what's the risk benefit. So if you go for your regular appointment, well, then, you know, your risk of having gum problems is lowered. Whereas if you don't go, well, your risk is higher. The benefit of going is, well, you know, I think I'm sort of explaining it to you very, very simply. I apologize for that, but if you go, your gum problem will not be an issue. If you don't go, your gum problem could be an issue, but that's a case-by-case basis. So I can't give you a clear enough answer, unfortunately. But let's say you go and your gums are in good shape, maybe skip the cleaning. You know, if your gums are not in good shape, maybe you need the cleaning every 3 months. So it's something that would be discussed on a case-by-case basis.
Okay, I got it. Yeah, thank you so much, doctor. Yeah, thank you.
Oh.
Okay, everybody, I'm going to have to end it there. I know that I'm not sure if anyone had any more questions, but what I can do is you can definitely send me an email. I can forward any additional questions to Dr. Karanofsky, and we can do that on an individual basis. But for now, I want to say, Dr. Karanofsky, thank you so much. We've gotten some comments already that this was a great presentation, and I think it was really informative. And yeah, on a personal level, it was really nice to hear. This is kind of an element of dealing with cancer that people don't necessarily think about. It's not always top of mind. So it's great to remember and to keep in mind. So thanks for reminding us to take care of our teeth.
Thank you very much for having me. Appreciate it.
So have a good evening, everybody. And this will be available. This recording will be available. I'll send it out to everybody when it's ready. So have a good evening. And thanks again, Dr. Karanofsky.
Thank you. You were great.
So much.
Thanks.
Thank you.
Have a good night.
Thank you so
Everybody.
much.
Thanks.
Take care, everybody.
Thank you, Carly.
My pleasure.
Thank you, Carly, also.
Pleasure. Take care, everybody.